Hey everyone, welcome back to Channel Name. You know I'm all about giving you guys the straight facts about health, and today we're tackling a topic that can be tough to talk about: miscarriage. It's more common than many people think, and it's important to understand what's going on and why it happens. We're going to break it down together, covering everything from what defines a miscarriage to the causes, the different types, and how to manage it both physically and emotionally. Remember, information is power, and my goal is to empower you guys with knowledge. So let's start with the basics. What exactly are we talking about when we say miscarriage? In the simplest terms, a miscarriage is the loss of a pregnancy before 20 weeks. Doctors might use the term spontaneous abortion, which can sound scary, but it just means the pregnancy ended naturally, not through a medical procedure. Now, I know this can be a really sensitive topic, and it's important to remember that miscarriage is never anyone's fault. It's not caused by anything you did or didn't do. It's a complex issue with a variety of factors that can come into play. We'll dive deeper into those factors in a bit. But first, let's talk about why miscarriages happen. Okay, so we know that miscarriage means a pregnancy ends naturally before 20 weeks. But why does this happen? Well, there's no single answer, and that's what can make it so frustrating. Often the exact cause remains unknown, but we do know that most miscarriages, like around 70%, are linked to chromosomal abnormalities in the developing baby. These are genetic issues that happen by chance and usually aren't related to the parent's genes. Think of it like this. Sometimes nature just takes its course and the cells don't divide properly, making a healthy pregnancy impossible. Beyond chromosomal issues, there are other potential culprits like maternal health problems, hormonal imbalances, uterine abnormalities, infections, and even lifestyle factors. We'll break these down in more detail later on. Let's take a closer look at what actually happens in the body during a miscarriage. It's not easy to hear, but knowledge is power, right? Typically, a miscarriage starts with cramping and vaginal bleeding. This happens because the embryo, which is the earliest stage of pregnancy, stops developing, and the body naturally tries to expel the pregnancy tissue. The cramping you feel is the uterus contracting to do just that. The bleeding can vary from light spotting to heavier than a period, and it can last for a few days or even a couple of weeks. It's important to remember that every woman's experience is different, and there's no normal way to go through this. Chapter 4. Why miscarriages happen, risk factors and statistics. Now let's talk about why miscarriages occur. Miscarriages can be a deeply emotional and often misunderstood experience. Understanding the reasons behind them can help in coping and prevention. It's important to understand that miscarriage is sadly more common than many people realize. Many couples suffer in silence, unaware that they are not alone in their grief. About 10 to 20% of known pregnancies end in miscarriage, which is a significant number. This statistic highlights the importance of awareness and support for those affected, and many more may occur before a woman even knows she's pregnant. These early miscarriages often go unnoticed, but they are just as real and impactful. There are certain risk factors that can increase the likelihood of miscarriage, and understanding these can help in managing and potentially reducing the risk. And while these factors don't guarantee a miscarriage will happen, they do play a significant role. It's crucial to have open conversations with healthcare providers about these risks. They're important to be aware of. Being informed can empower individuals and couples to make better health decisions. Age is a big one. As women age, their reproductive health changes, which can affect pregnancy outcomes. As women get older, especially after 35, the risk of miscarriage increases. This is due to a variety of factors, including changes in hormone levels and egg quality. And even more so after 40, the risk becomes even higher. This is a natural part of aging, but it can be managed with proper medical care and lifestyle adjustments. The risk of miscarriage goes up. Regular checkups and early prenatal care are essential for monitoring and managing these risks. This is mainly due to the quality of eggs declining over time. As women age, the number of healthy eggs decreases, which can lead to complications. Other risk factors include having certain medical conditions like diabetes, thyroid disease, or autoimmune disorders. These conditions can affect the body's ability to sustain a pregnancy. Lifestyle factors like smoking, heavy alcohol use, and drug use can also increase the risk. Making healthy lifestyle choices is crucial for reducing the risk of miscarriage. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and stress management, can significantly improve pregnancy outcomes. It's about creating the best possible environment for a healthy pregnancy. Emotional support is also vital. Joining support groups or seeking counseling can provide much-needed comfort and guidance during this challenging time. Remember, while risk factors can increase the likelihood of miscarriage, many women with these risk factors go on to have healthy pregnancies. Staying informed and proactive is key. Chapter 5. Types of miscarriage. Understanding the variations. Miscarriages aren't all the same. They can vary significantly in terms of timing, symptoms, and underlying causes. Understanding these differences is crucial for both medical professionals and those affected by miscarriage. There are different types, each with its own characteristics. Knowing the type of miscarriage can help in understanding the experience and in seeking appropriate medical care. One type you might hear about is a chemical pregnancy. This is a very early miscarriage happening within the first few weeks of pregnancy, often before a woman even misses her period. Chemical pregnancies are often detected because a woman takes a pregnancy test that shows a positive result, but then she starts her period shortly after. This can be confusing and emotionally challenging. It's called a chemical pregnancy because it's detected by a blood test showing pregnancy hormones, but an ultrasound wouldn't yet show a visible pregnancy. This type of miscarriage is quite common, though many women may not even realize they have experienced it. Then there's a missed miscarriage where the pregnancy stops developing but there are no noticeable symptoms like bleeding or cramping. This can be particularly distressing because the woman may still feel pregnant. This type is often discovered during a routine ultrasound. The absence of symptoms can make it a shocking and heartbreaking revelation during what is expected to be a routine checkup. Another type is a blighted ovum, where a fertilized egg implants in the uterus, but the embryo doesn't develop. This can be detected through an ultrasound that shows an empty gestational sac. And sadly, some women experience recurrent miscarriages, which means having 3 or more miscarriages in a row. This can be particularly heartbreaking and often requires further investigation to determine the underlying cause. Recurrent miscarriages can be due to a variety of factors including genetic issues, hormonal imbalances, or anatomical problems. Seeking medical advice and support is crucial for those going through this difficult experience. Understanding the variations in miscarriage can help in providing the right support and care for those affected. Chapter 6. Managing miscarriage, physical and emotional healing. Going through a miscarriage is physically and emotionally challenging. The experience can be overwhelming, leaving you feeling lost and unsure of how to move forward. It's important to recognize that this is a significant loss and it's okay to grieve. There's no right or wrong way to cope, but there are ways to manage the physical and emotional aspects. Everyone's journey is unique, and what works for one person might not work for another. Finding your own path to healing is crucial. Medically, your doctor might recommend a procedure called a D&C, which stands for dilation and curettage, to remove any remaining pregnancy tissue from the uterus. This procedure is often necessary to ensure that your body can heal properly and to prevent complications. This can help prevent infection and reduce bleeding. It's a common procedure, and your healthcare provider will guide you through the process, addressing any concerns you may have. In some cases, medication might be an option to help the body naturally pass the tissue. This can be a less invasive alternative to surgery, but it also comes with its own set of considerations and potential side effects. Beyond the physical, it's crucial to address the emotional impact. The emotional toll of a miscarriage can be profound, affecting your mental health and overall well-being. Miscarriage can trigger a roller coaster of emotions, sadness, grief, anger, guilt, even relief. These feelings are all valid, and it's important to acknowledge them rather than suppress them. It's essential to allow yourself to feel these emotions and not bottle them up. Journaling can be a helpful way to process your thoughts and feelings, providing an outlet for your grief. Talking to your partner, a therapist, or a support group can provide a safe space to process your feelings. Sharing your experience with others who understand can be incredibly comforting and can help you feel less isolated during this difficult time. Additionally, engaging in activities that promote relaxation and mindfulness, such as yoga or meditation, can help you manage stress and find a sense of peace. Taking care of your physical health through gentle exercise and proper nutrition is also important. Spending time in nature, whether it's a walk in the park or simply sitting outside, can be incredibly healing. The natural world has a way of grounding us and providing a sense of perspective. Engaging in creative activities such as reading, painting, or any hobby you enjoy can also be a great way to distract your mind and find joy in small moments. Remember, healing is a journey, and it's okay to seek support and take the time you need. Surround yourself with people who care about you and allow yourself to lean on them. By addressing both the physical and emotional aspects of miscarriage, you can begin to find a path forward. It's a process, but with time, support, and self-compassion, healing is possible. Outro: finding support and moving forward. Miscarriage can be a heart-wrenching experience, but it's vital to remember that you're not alone and there is hope for the future. Many couples who experience miscarriage go on to have healthy pregnancies later on. If you're going through this, please don't hesitate to reach out for support. Talk to your doctor, a therapist, or a support group. Remember to be kind to yourself. Allow yourself to grieve, and know that healing takes time.